My name is Dr Christopher Critoph, and I'm a consultant cardiologist based in Bournemouth in Dorset. So, why did I decide to do cardiology? I think there were a number of reasons. I had a great time in my junior doctor years learning about cardiology, and I think that really set the foundation. But um, there are a number of specifics about the specialty. Firstly, as a cardiologist, I get to be involved in sort of every step of the patient journey, from diagnosis. We have access to a wide variety of investigations and CTs, echoes, MRIs, and so on. Get to be involved in treatment with medications, surgical procedures, stents, pacemakers, all these things. So it's really very varied. And not only is the subject varied, the different conditions that patients present with are very varied. So I'll see patients with, for example, raised cholesterol or high blood pressure, angina, palpitations, breathlessness, all sort of a variety of different symptoms, and it keeps it really interesting, the fact that there is that variety. I think lastly, so I was a medical school in the late 90s, and since then there's been an absolute explosion in evidence-based treatments for cardiology. We have really good, robust, randomized trials demonstrating significant benefit if people get on the right treatment to improve their quality of life and their length of life. So having, I'm a big believer in evidence-based medicine, and having that large evidence base just is, really important to me in my clinical practice. I think the most rewarding aspect of being a cardiologist is really the fact that patients can just feel so much better with the right treatments. You can take someone who, for example, might have significant breathlessness from heart failure, for example, turn it round, reverse it, get that person's heart back to normal, and then they feel well again. And so having access to those sorts of therapies that make such a difference in patients' lives, I think is extremely rewarding. What can patients expect when they come for a consultation with me? I think the overriding sense that I want patients to come away with is that they're being treated as a normal human being. It's not nice being a patient. I've been a patient myself, and being listened to and heard, I think, is incredibly important. I'm very empathetic and will, really take the time to treat patients as individuals. And we're very different, and what works for one patient won't necessarily work for another patient. And so, giving patients options and trying to find out what works for them, I think, is key. I also pride myself on communication. We often talk about some very complicated medicine in clinic and complicated cardiology, but getting these sort of complex issues across to a patient in a language and a way they can understand, I think, is really, really important. And so, for example, I use models of the heart and diagrams and videos to try and really make a patient, understand what's going on, because I think a well-informed patient is going to have overall a much better outcome. And so, I think they would come away from a consultation with me feeling heard and well informed.